Hi, my name is Dr. Tokes Archie. I am sharing with you this short presentation about sickle cell beta thalassemia from my family's perspective. So, this is my family story, or part of it. I do want to apologize to any of you who have been waiting for me to upload something about my journey and what my family has experienced with sickle cell beta thalassemia plus. I hope this video is informative and helpful. I would put my contact information in the comments below, and place some links below so that you can reach me if you wanted to ask me some specific questions. You can also put some comments in the chat. All right, I hope you find this helpful. Here is my family. Their faces have been blotted out or changed for security reasons, but I did want to introduce my family. We are a large family. You would see that there are 5 sons, 2 daughters, and then there's my husband and myself. So the individuals with the red smiley faces are the 3 sons that have sickle cell beta thalassemia plus. The world calls them sicklers, but I do not. I call them well ones because that's me by faith pronouncing that they are well despite whatever it is they have inherited. And I am thankful to God that this has been the case. So, as you can see, there are 2 of our children that have the black smiley face, and those are our son and daughter who are without any trait. They don't have sickle cell trait or thalassemia trait, so they don't have any of that. Then you'll see that there's a son and a daughter that have the smiley face with the little red eye. They are the 2 that have sickle cell trait. And then my husband is the one with the smiley face with the little orange eye. He has thalassemia minor, which is also a thalassemia trait. And I have the red eye, and I'm in the middle next to my husband. And I have the sickle cell trait. So I'm going to talk a little bit more about inheritance of the sickle cell beta thalassemia. Then, all right, so that was our family. Inheritance of sickle cell beta thalassemia. So people who have this form of sickle cell disease inherit one sickle cell gene, the S gene, from one parent, and one gene for beta thalassemia from another parent. There are 2 types of beta thalassemia. There is the 0 and the plus. So those who have hemoglobin S beta 0 thalassemia usually have the severe form of the sickle cell disease, and people with hemoglobin S beta thalassemia plus tend to have milder form of sickle cell disease. This doesn't mean that they don't have complications, issues, crises, but it's much milder than those who are sickle cell beta thalassemia 0. So if you see, as you see on this schematic here, it's kind of demonstrating how the inheritance pattern occurs. Some of you know already, and for some of you this may be too technical, and others really want to know, how is it that my child has this, or how is it that I have this, if you are new to the diagnosis. As you see from this, red means normal. So as long as the person inherits that red portion, they would either be fully normal, as you see by that square to the left, or they would have trait. In this case, the person with the sickle cell trait has the red and the green, and the person with the beta thalassemia trait or thalassemia minor has the red and the purple. Now, if a person inherits both traits, they are traits, as in sickle cell trait and beta thalassemia trait. But if you have half being one trait and the other being another trait, it equates to having the disease. So a person with sickle cell beta thalassemia plus or sickle cell beta thalassemia 0 essentially has no blood that's truly normal, or a small amount of blood that's actually normal, so they actually have the disease. So this is the case with 3 of our children, and this is the case with anybody who's watching this who has been diagnosed with the dual trait. It is considered a disease, by the way. So by the way, yes, I was saying that This is the pattern of inheritance. Now, did you know that sickle cell beta thalassemia is very, very rare? I think I saw somewhere that it was 0.04% of the world, or 0.004% of the world actually has that combination of inheritance. However, in Turkey and in the Mediterranean, Italy, this is actually quite common. Um, so they have a lot of sickle cell beta thalassemia in that region of the world. So I did want to show you um, uh, what the slide looks like for normal blood and what the slide looks like when the blood is um, for a person who has sickle cell beta thalassemia. So on the one side, you see where it says normal blood, and you see that the cells they're round. They have a little bit of a pale interior, but they're round. There's a cell in the center that looks like it has something that looks almost like a fetus, but that's not a red blood cell. That is a different type of cell. But you can see that that's normal blood. You know, on the right side of your screen, you would see the blood for someone who has sickle cell beta thalassemia. Um, this is a less concentrated specimen, but you can see that they're normal cells. That you see um, that are similarly round. And these are RBCs, red blood cells, or erythrocytes. They're round with a pale interior, but you also see the arrow pointing at some cells that look elongated. So those are sickle cells, and then there are other different shapes of cells which are more like cells that are affected by the thalassemia. So I just want to give you an idea what the cell looks like for normal blood, and I mean, the blood smears look like for normal blood and what they look like for sickle cell beta thalassemia. For those of you that may be interested in this, I know I wanted to know, so I'm sharing. Now, our first child that was born with sickle cell beta thalassemia was born in 1996, and that is our first son, second child, who is now 28 years old, and I give praises to the Almighty God for that. He was born in the state of Maryland, and 1 month after his birth, we received a call stating that he had sickle cell. I may have mentioned this before. What happened was that my husband did not know that he had a sickle cell beta thalassemia. I'm sorry, that he didn't know he had beta thalassemia, and I knew I had trait. We found out that he had beta thalassemia after the child was born, and this is because they do the newborn screening. Okay, so with the newborn screening, this screening aims to detect the presence of abnormal hemoglobin. It detects abnormal hemoglobin, which is also known as hemoglobin S. It doesn't screen for other things like thalassemia because the test for that is different. This test is called an electrophoresis. So if you are someone who was born a little bit, earlier, you may not have been tested for sickle cell. Um, and if you were tested for sickle cell, you may not have been screened for other things. So if you feel that there's something going on, you need to go back to your doctor or find a hematologist who will do the whole panel for you to find out what is happening with your system, to see if you do have hemoglobin S, or if you have trait, or if you have a different kind of variant. Now, the newborn screening is a high performance liquid chromatography or electrophoresis to separate and identify different types of hemoglobin that are present in the blood sample. In this picture, you see how they are taking the blood from the baby's heel, and those of you who've had newborns, you see that that's what they do, and they dab it onto this pad, and one of those will be taken for hemoglobin electrophoresis, and that's how they would determine whether there are sickled cells in the baby's blood. Now, there are other tests that are done for newborns, so this is just one of the tests. I wanted to point out that there's this quick fact that New York was the first state to implement newborn screening for sickle cell, and that was in 1975. It took up until 2006 before there was universal newborn screening for sickle cell disease in all states, including Puerto Rico and the U.S. Virgin Islands. So keep in mind that in states where this was not implemented before 2006, there may be people who have sickle cell disease especially the milder variants who may not know that they are dealing with this. So it's important to get screened or tested if you think that may be going on. Well, after our son was born, our first son, second child was born, and we were told that his hemoglobin electrophoresis came back showing that he had full blown sickle cell. I was shocked. I did not know, but I am a person of faith, and I had an inkling that there may be something going on with my son before he was born. Not because anything happened, but just by prayer, I kind of knew that there was something that I would find out later. Um, anyway, that's just a side comment. They told us we had to go to a geneticist to find out who had what. I knew I had sickle cell trait, but my husband did not know he had any kind of trait. We were told after the genetic testing what my husband had, which was beta thalassemia minor, and my sickle cell trait was confirmed. Our oldest daughter was confirmed to have sickle cell trait as well. Our son still showed that he had full-blown sickle cell. They suspected that it would be sickle cell beta thalassemia plus, but they told us we had to wait till he was 1, because at the age of 1, that's when most of the newborn cells have um, shifted over to adult cells, and that's when you would know what picture you're actually dealing with. Yes, so I just wanted to say a quick word about genetic testing and genetic counseling. So we went to genetic testing, and that was because I knew I had sickle cell trait, but my husband did not know what he was carrying, and I also did not have any paperwork to confirm that to confirm the sickle cell trait. So we went to genetic testing. We were tested, my husband, myself, our first daughter, our newborn child at the time. Actually, he wasn't a newborn at the time. I think he was closer to 6 months, maybe 7 months. And so we went to testing, and they confirmed what we all had at that time. Now, genetic testing can be done for so many different reasons, but back then it was more specific. As you see on this slide, taken from genome.gov, at the bottom it says screen newborns for certain treatable conditions. Sometimes genetic testing is used for that. In our case, we needed to diagnose our son's disease, and that was the main goal, to confirm what exactly he had and who was contributing what to his condition. So, diagnosed disease is one of the reasons to do genetic testing. Pinpoint genetic factors that cause your disease, how severe it is, what are the medications that are best, what factors increase your disease risk, and what you could possibly pass on to your children. So, genetic testing is important. That's what we went to. Now, genetic counseling is the process of helping people understand the genetic contributions to disease, and then to help them also adapt or change or adjust to what that really means medically, psychologically, familially. So counseling is kind of different. It's kind of like support after you find out what you're carrying and how it could impact your family. Testing is finding out exactly what's going on. So I wanted to mention that. So excuse this rather plain slide, but I just wanted it to be a reminder that your baby should be seen by a hematologist before he or she is 4 months old. They would recommend penicillin prophylaxis, which means taking penicillin to prevent disease, and pneumococcal vaccination. Okay, so that's just so you know that that's a recommendation. How did I feel about penicillin use? When our son was 2 months, he was placed on penicillin. Now, a side note is that penicillin is for infection prevention. Doctors will recommend penicillin, or they would recommend amoxicillin. Okay, but you have to talk to your doctor to see what they're recommending. For us, they recommended penicillin, and he had to take, I'm trying to remember here, but I believe it was 1 teaspoon once a day. And that medication really did cause problems for him. His urine stunk to high heaven. Yes, sorry for that pause. So yes, his urine smelled really badly. It smelled like medicine. Um, I'm not sure if we were taking it once or twice a day. I think it was once a day, but that was 28 years ago. And I remember being told that if he didn't take it, something bad would happen to him. And I was so terrified. I was very young, I was in my early 20s, and the whole thing was distressing to me. But I say all that to say that just be encouraged that it may be a little bit tough giving your child this medication, not knowing what else it may be doing to his system. Back then, they did not tell us anything about probiotics, so he just took the medicine to kill off bacteria, and if it killed off his normal bacteria, aka the probiotics, we didn't know at the time. He would have loose stools, his urine smelled really badly like penicillin, and I prayerfully made a decision different than what the doctors were recommended, but I don't want to share that because I know that that was my personal decision, and I know it was a risky decision. But I'll just say that our son used penicillin as recommended. Um, they say that the risk of um, of a child developing sepsis is as much as 30 to 600 times higher than other children. So, because a child who has sickle cell doesn't have a spleen that's working well, they can fight off certain bacteria. And if that gets into their system and it gets away from them, then they can get into real problems. And sepsis is the infection that's a blood infection that can occur from that, and it can kill. All right, so having said that, we did not mess around with fever. We really didn't. When you look at this slide, you see that it says fever classification. For a regular person, a low grade fever is 38 to 39 degrees Celsius, or in the US here, we use Fahrenheit, so 100.4 to 102.2 degrees Fahrenheit is considered a low grade fever. With someone who has sickle cell, no, 101 is the cutoff. 101 is considered a high fever and an alarming sign in somebody who has sickle cell. So we didn't mess around with fever. We made sure that we paid attention to what was happening with our son, and I'm referring to our first son, second child, because he was the one who really taught us how to deal with his brothers, because he was the first. So anyway, from when he was younger, we decided that if he had any fever, we would get a hold of his doctor. If it was in the middle of the night, we would get him to the hospital or urgent care or somewhere where he could be seen. Um, we decided that we would do this because we knew we were not always compliant or not always taking the penicillin as the doctor recommended. I admit, and because we weren't that great with that, we needed to be more aware. Our son did get his vaccinations. However, at that time, which was 28 years ago, I don't think they had the pneumovax that they have now. I don't think so. There were other vaccinations that helped him, or they told us would help him, so he got those, but we weren't that compliant with penicillin. We tried. Anyhow, so I would suggest or recommend or emphasize to anyone, don't mess around with fevers at all in somebody who has sickle cell. And if you're an adult, even if you think you know the reason why you're having the fever, you have to deal with it. You have to tend to it, because 101 may indicate that a person may be starting out to have something that like a pneumonia or something that could lead to sepsis, and sepsis is what you don't want, because that is a bacterial infection that has spread to the blood, and that can go bad very fast, and like I mentioned before, it can kill pretty fast. I had an auntie who died in her 40s. She did not live in the United States. She lived in a different country, but the reason why she died was because she had sickle cell. She got an infection of some sort. It spread to her blood very quickly. She became septic, and she did not make it. And so it's a very serious thing. So don't mess around with fevers. That's what I would say. That's very important. So I wanted to mention something about RSV pneumonia and just give you some information about that. Well, not really clinical information, merely just sharing what happened with my family. So I would say with all of our children, not all of our children, but all of the children that we have with sickle cell beta thalassemia, RSV pneumonia was a problem for us. Our first son, that was the first and only time, first time in his life that he was hospitalized was because he developed pneumonia. We took him to the hospital because his temperature was, higher than the cutoff. And when we got there, it was RSV pneumonia. And by the way, RSV is respiratory syncytial virus. It affects children, especially babies, newborns, infants. Our first son was hospitalized with that when he was 10 months old. That was very hard for us, but he pulled through. Praise God. Now, our other son, who's our fourth child, who's the second person with the sickle cell beta thalassemia, also developed RSV pneumonia, and how it showed up was similar. There was, fever and poor breathing, wheezing. We had to take him to the hospital, and he had to be hospitalized and placed on oxygen and given medication to support his system. He pulled through. Our third child that has sickle cell beta thalassemia was not hospitalized with RSV pneumonia, and that's, I believe, because we were more aware of what to do, and also because we were told by someone at a clinic when our child was going through something respiratory, we weren't sure what it was, that something called elderberry was helpful in preventing flu and viral infections. I can send you more information about elderberry. I am not saying that you should take this in substitution for what your doctor is recommending, but I'm saying personally that that's something that helped us with our third child, and he did not get hospitalized with pneumonia, any viral pneumonia or RSV pneumonia when he was younger. So I do want to mention some of the triggers of sickle cell pain and crisis from our experience. Dehydration is a big deal, yes. And when our first son, second child, who was the first one we had to take care of with sickle cell beta thalassemia plus, when he was younger, keeping him hydrated was a challenge. He would go to kindergarten, and at the time he was not homeschooled, and would not hydrate. Would forget to drink his water because he just wanted to play outside, and he got dehydrated quite a bit. And that caused a lot of fatigue. Occasionally he'll get bad pain. It got worse as he became a teenager and was playing more outdoors during the summer. Stress is always a big factor, huge factor that is so underrated, underestimated, but that's a trigger. Emotional stress, mental stress, any kind of stress trigger. Infection for sure. So our sons may start out with just something mild where you think it's just a little bit of a cold, a little bit of a cough, or everybody's coming out with something viral which is mild to them, but in our sons it would trigger a crisis, or could trigger a crisis if we didn't get ahead of it by giving them certain things, making them rest, making them hydrate, giving them supplements, vitamins, chicken soup, anything you could think of, to keep them from having to go to the hospital. My target and my goal was to prevent crisis as much as possible because I wanted to keep my children out of the ER, out of the hospital. I didn't want them to get as much crisis so that they had to be treated with pretty strong medication at a very young age. Now, this may not be possible as much with somebody who has sickle cell, which is SS. Our children have sickle cell beta thalassemia plus, and I'm just expressing and sharing how things worked out for us. first, I give all glory to the Most High God for his help. And I am going to say that publicly, that I prayed a lot. I still pray a lot. And I know that, his hand covered and covers our children and will continue to do so by his power. But the other thing is, like, I stayed very aware of these kind of triggers. Like I said, dehydration, stress, infection, temperature changes, especially going from hot weather into a cold pool. That was a big no-no. Weather changes, big deal. Um, Pressure changes, like playing snow sports, we did not do that at all. Although one of our sons did go on a high altitude on a retreat to a place that was pretty high up there in the mountains and had to be brought down almost immediately because that altitude caused um, severe crisis and abdominal pain, lots of problems, weakness, fatigue. It was quite bad. Flying does that, and I'll just say this much: before, I really didn't know how bad the altitude could affect a child, but our first son, second child, did have real issues with that, and I caught on eventually when I figured out that the altitude was an issue. So what I would tend to do is I would never schedule a flight that was more than 2.5 to 3 hours, maybe 3.5 at the most, without coming off of that altitude. So if we were going somewhere, I would schedule layovers so they can get off the plane, de-stress, recalibrate a little bit before taking the next leg. We haven't traveled anywhere that's that far. We've gone across the country here in the U.S. But when I book the flights, I make sure that there's a long layover and that the flights are no more than 3 hours, maybe 3.5 hours, because then they start to have problems. And I fortify them with a lot of supplements and things before they travel. Anyway, our sons are not females, so they don't have periods, thank goodness, and so that's not a trigger. Sex is a trigger, I'm pretty sure, but I wouldn't know because I don't share that bit of information with my adult son at this moment, but I'm sure it is. Rigorous physical activity for sure. They play basketball and that created problems. So those are things that are triggers that we are aware of, and you need to be aware of too. If you are the one with the sickle cell, you know already. And if you're a mother of one with sickle cell, you should know these things and keep your child from these triggers. Just like this young man, our first son was a trooper. When we take him to the hospital, he did have to have blood draws. He wasn't hospitalized a lot when he was younger. He did have pain in his arm when he was, 3 or 4. That's because we're living in the state of Maryland and there was cold weather. And so with the cold, his arm mainly would feel pain, and I would take care of his pain in various ways. So I'm going to talk a little bit about our experiences and how we took care of our son's symptoms. So as I told you, our son did very well, and I'm using him as the example because he was the one that we learned what to do. We learned from him what to do. I put this here because when he was younger and his hands or arms would hurt, I would cut up socks and I would stuff like warm washcloth in the socks and wrap it to kind of seal the heat, and I would change it, and that helped with the pain a lot. Our water bottle was our friend. Now there are heating pads, but back then we used the water bottle. And we also knew no ice on any injuries, no ice on any boo-boos. That was a big no-no because that caused more problems. Now, we used Tylenol and Motrin for our son, and we used that for him for a long time. And I did that specifically because I didn't want him to get used to the more severe painkillers before he was in his adult years, because then by that time he'll be so used to narcotics and they may not work as effectively. Thankfully, because we were paying attention to him, hydrating him, watching him, he didn't have a lot of crises. We maintained healthy eating, and we just paid attention. I think that's the key. We paid attention and protected him from the elements. We homeschooled him and homeschooled the rest of his siblings as well. so he didn't have a lot of the stresses that would trigger crisis. And as an infant, we just used these, and as an adult, he got used to using that until he got more physically active, and then stronger medication was needed because his crises were more severe. One thing I did want to mention, which may not be happening in your child, but this is something that it will happen or happens with our children, is the ones with the sickle cell beta thalassemia tend to have a lot of stomach pain. I'm not sure why. So when I get more information about that, I would mention. I will let you know. But we've used different things with our oldest son when he was 4 or 5 years old. The doctor wasn't sure what was causing his abdominal pain. Wasn't sure if it was constipation. We tried to relieve any constipation. They sent him for an x-ray, didn't show anything. I think we were scheduled for an ultrasound as well. I don't remember if we did get the ultrasound. I don't think it showed anything. They tried him on some anti-acid medication that helped a little bit. So I'm not sure if all children with sickle cell beta thalassemia or adults have problems with stomach pain, but for our children, that's something that happened a lot. And our child now, who is the youngest one, he does have issues with stomach pain every other day almost. We are scheduled for an ultrasound. He is 14 years old now. And when he was younger, this is our youngest child, when he was younger, he did have nausea, some vomiting, stomach pain, but it was mixed up with a lot of other symptoms, so we didn't think it was just his stomach. Now it is just his stomach, so we're going to go see what's going on. He tends to respond to Tums when we use Tums. His older brothers do tell him that they still have stomach aches, and that it gets worse if they don't eat first thing in the morning and get good meal in. So we've been working on him to eat well. His appetite's not the greatest. I have used chamomile tea, peppermint tea, to help soothe him, and that helps. And then I also have a little pain rub that I will rub on his stomach, and that has helped. Stress makes the stomach pain worse. Antacids do help, and we're going to see when we get the ultrasound if there's anything else, and then I'll keep you posted. I did want to make sure that I mentioned some more things about stomach pain or abdominal pain. It's a pretty serious thing, so if your child develops sudden stomach pain out of nowhere, go to the hospital. It's better to be seen and to make sure that your child is seen than to wing it, or as it were, stay home and try to manage it yourself if it happens suddenly. And if you're the person with sickle cell and you're developing sudden abdominal pain, you need to go to the hospital. There are other things that can occur in sickle cell, where there is some obstruction or what they call an infraction. Basically, if there is something that stops the blood flow to a section of the colon or small intestine, that area could um, result in severe pain because it's not getting blood flow, and that area is having a heart attack. It's not the heart, but it's kind of similar to a heart attack, where there's blockage and then there's pain. So that can happen. On the simplest note, children or people with sickle cell beta thalassemia, and I suppose other types of sickle cell, deal with constipation. So relieving constipation is important. Sometimes they can develop a urinary tract infection, and by the way, that does happen in sickle cell trait as well. They're more prone to urinary tract infections and kidney infections. So depends on where they're having their pain. A urinary tract infection is something that can occur. It could be an ulcer. It could be a blockage of their gallbladder, which can happen and is common. It could be something more serious like appendicitis. So the bottom line is, if your child always has stomach pain, and that's kind of how their disease is showing up, and you've been seen and you kind of know this is what happens, you know how to relieve it, that's different. Continue what you're doing, but be aware that sometimes it could be something that's more serious, or something that's related to an infection, or something that's related to blockages, or what they call a vaso-occlusive crisis in the stomach. So if there's a sudden change in the quality of the stomach pain, or it's worse now, or it feels different, or they have a fever with it, or they're throwing up now, any change from whatever you think is the norm needs to be addressed. And if it's sudden abdominal pain, go to the hospital. So that's important. I just wanted to make sure you don't try any home treatments, it, for something that could be more serious. Abdominal pain can be very serious. So pay attention if you're the one with sickle cell, or if you have a child who has sickle cell. So, all right. So this is the end of this presentation, I guess, or vlog, sharing experience. Not sure what to call it, but I hope it was helpful. I want to make sure that you please seek advice of your doctor or your primary care provider, or a bona fide, knowledgeable naturopathic doctor before making any changes to your medication or your treatment plan. This is very important. I would try my best to share more of my experience. Please note that these are my experiences, and you need to make sure that you know what's right for your child. Seek advice from those who know, and don't make any changes drastically until you're sure. When in doubt and something feels serious, go to the hospital or take your child to the hospital. I will try my best to post more information, and I hope that it is helpful. If you are a person of faith, stay prayerful and keep watch. Take care.